So I want to thank you from the bottom of my heart. My name is Brandy Christensen. I'm the president and CEO of Mental Health America Wabash Valley Region. I've been here just over 5 years, and it is my supreme pleasure and privilege to be speaking to you this morning on what is our very first Founders Day. And so as I was kind of alluding to, our staff said, hey, you know, I don't think too many people know about the origin of Mental Health America. We're like the oldest mental health non-for-profit in our area, in our region. And we've got a pretty cool founder. His name was Clifford Beers. We call him around here the OP, the original peer. And Stephen's going to talk a little bit more about him. But we have a lot of milestones this year. We're celebrating 75 years as a non-for-profit in Lafayette. And we are also celebrating 20 years in this building. Thank you to NCHS, and we'll talk a little bit more about that. So we're going to take a little trip down memory lane this morning because, as we know, you can't know where you're going unless you know where you've been. So I'm kicking this off, our very first Founders Day, February 19th, and our first speaker after me is going to be Stephen Horrocks, our development director. He's going to talk to you a little bit about Clifford Beers and why he's so important. And then I'm going to take you a little bit more down the timeline of the history of Mental Health America. So thank you.
Thank you so much, Brandy, and thank you all for being here. I want to take us back to around the turn of the 20th century. Because the story of this agency does actually predate when this agency was founded itself here in Tippecanoe County. And right around the turn of the 20th century, early 1900s, there was an individual by the name of Clifford Beers who experienced fairly significant mental health challenges. As it is now, that diagnosis would likely be something along the lines of bipolar disorder, which is very different language at that point. However, during this time, treatment for these kinds of mental illnesses generally included simply institutionalization, right? Folks went into psychiatric wards or even psychiatric hospitals, excluded from other hospitals. And generally speaking, they were not treated well. And that's an understatement. It was actually kind of horrific. Clifford Beers himself went into more than one of these facilities as he was seeking recovery and a path forward for himself in this world, and in the experience of that oppression, continued to advocate and fight back against it. After he had been discharged from one of these institutions, he decided to share more about that story to help push that mission forward. In 1908, he published his autobiography, A Mind That Found Itself, and much like other autobiographies, and in that genre in general, it's more than just telling his personal story for the sake of telling. It was a call to action. Right on the tails of the publication of this book, in 1909, Clifford Beers founded the Connecticut Mental Hygiene Society. And thereafter, within that same year, February 19th, as it turns out, founded what would eventually be named the National Mental Health Association, now Mental Health America. That agency has, since that time, not only continued to advocate for the rights of those with mental illness and destigmatizing mental health in general, but it has expanded to such a degree that now there are more than 200 affiliate agencies throughout the United States moving this mission forward in their local communities, just like ours here. And in 1950, right around the time where I'll pass off to Brandy here in just a moment, the National Mental Health Association put out a call to gather the shackles and the restraints from those institutions that were being closed throughout the country, largely due to the work of Beers and those who were in the work with him. They gathered these in their headquarters and decided that they needed to do something meaningful with it to help move the mission forward rather than just looking back. So they brought all of those chains and shackles to the foundry. It was a foundry in Maryland, actually, and they cast from those shackles a bell. And that bell was inscribed with a meaningful phrase that now is really the heart of why it is that the bell stands in our foyer, why the bell sits on our logo, and why we see this imagery in general. As we walk through this history of this agency, specifically in Tippecanoe County, I think it's important to note that this is part of something bigger than just what's happening here and the work that we are doing and that those have done prior to our time in the work is connected to this larger movement for justice, for empathy, and for the rights of those with mental illness. And so today, this bell is a symbol of hope. And its alternate name is actually the Hope Bell. The Hope Bell that we ring out as staff, as our clients, as our partners. We ring out on this bell anytime we have a victory in relation to this work, right? We ring out hope for victory over mental illness and for the rights of those who experience these mental health challenges. So with that, I will pass back to Brandy to talk about how that has been rung in over the last 75 years here in Tippecanoe County.
I once asked a mentor of mine what the secret sauce to success was, and he said, hire people that are smarter than you. I evidence that has been a recipe for success here as well. And before I forget, I definitely do want to recognize the incredible amount of work that Chris and Stephen and Holly and just the whole team put into making this possible this morning. So I had occasion to invite the former CEO here, along with one of our what I would call more recent founders. In other words, we wouldn't be where we're at today without them. Linda Rohrman, who was unable to be here with us today, but we sat and chatted with Jennifer Floor for quite a while, and I really enjoy those chats because Jennifer spent 25 years at the helm of this agency. And so a lot of what I'm going to be talking about is stuff that I've culled from her memory. And please feel free to correct me if I misspeak or have an error. But what we know about our origins is in 1950, Circuit Court Judge Lynn Parkinson and County Welfare Department Director Juliet Schneider and the Chamber of Commerce President W.G. Neilbert Jr. Formed at the request of community leaders the Tippecanoe Mental Hygiene Society, and it was formed as an affiliate of the National and State Mental Hygiene Societies, and Rabbi Elliot Einhorn served as its first president. That's what we know about the very beginnings of Mental Health America here in Tippecanoe County. In 1953, the same year that the Bell of Hope that Stephen was discussing was smelted, MHA's first program, Christmas Gift Lift, was launched. And that program served all the way up into COVID, at which time, due to duplication with other organizations and a lack of volunteer ability, that program actually fell. So 1956, MHA became a partner agency of what was known as the United Fund in Tippecanoe County. And the next year will mark 70 years that Mental Health America has been a partner-funded agency of the United Way. And we are just so proud of that partnership and that work and how it connects us into the social fabric of all the other United Way serving agencies and those that aren't funded. So we do thank the United Ways in all of the counties that we work, because you keep us directed and connected. And so in 1970, I'm going to shift just a little bit here because we're following a parallel path. 1970, a group of counseling and clinical psychology graduate students recognized the need for crisis intervention, education, and referral services for Purdue students. With faculty advisor Don Hartsaw, who's a PhD, he's a psychologist, I believe, and other interested social workers, psychologists, and psychiatrists, the crisis intervention phone service began operation in the basement of the Purdue Education Building and was later renamed the Lafayette Crisis Center Foundation. And we'll talk about why that matters in a couple of moments. Hearing Don tell his story, he also wrote a book as well, documenting that journey and some other journeys that he had with mental health crisis throughout his illustrious career. In 1981, the William Potter family donated the Potter House and 3 adjacent lots to what was then named the Mental Health Association of Tippecanoe County. The Potter House was constructed in 1855 and on the National Registry of Historic Places is today, I believe, the 4th oldest building in the city, and is used at this time for our supportive housing program, even as many of our residents are aging out into the community. So, and then our MHA community building, you may know it as the day shelter, was also constructed on 2 of these lots. And so when we think of founders, as we discussed, is this the point? Where's Chris? Okay. We immediately thought of Linda Rohrman. Linda Rohrman has been part of our organization for, I think, close to 30 years. Is that right? Yes. And we had the pleasure of sitting down with her a couple of days ago. And this clip kind of talks about how she got involved and how the building funding here came to be.
Yes, and Sharon Drury, who got me involved with MHA back in 1999, just asked me if I would be interested in coming on the board of MHA. And I said, well, I don't know much about it, but let me think about it. And so I did, and 25 years later, I'm still involved.
Yes, you are.
So she was also very instrumental with me and Jennifer to get this building built.
This one that we're in right now.
Yes, because we went to John Walling, who was with NCHS, and I took him on a tour and showed him where our offices were. And I think he was appalled to find out that we were over there in that building with this much space.
Yeah.
And so then they agreed to build this building for us.
And so, so Linda and I talked a lot, and we've got some really good gold on video, which is just wonderful. But again, we also then were able to interview Jennifer. And when I asked her about the people that were involved at that time in the board, the donors, and their impact over time, specifically the Seaman family and the Rohrman family, this was her response.
In just a sentence, I can tell you with absolute confidence and certainty this place would not be here if not for them. This building would not be here if not for them. And we had some very active and effective people come onto our board at a time when this agency was very small, but we had put everything in place to grow a lot. I mean, everything from audits being 100% clean to programs having specific missions and outcomes and tracking those outcomes. And we had just worked really hard to get everything in place because we knew there was a lot of work to be done in this community, and we knew that we could do a lot of that and do it well. And these folks came on our board and they felt that too. You know, this place is ready to grow.
And I think that we've shown both in the time period that Jennifer had the helm for like 25 years, and even today that we are continuing to experience that growth. So we thank our forebears for their leadership and for their vision. So yes, thank you. Thank you. So Jennifer came in 1995, is that correct? 94. I knew it because when you said 25, I had 24. So so when I was a new recruit stationed in La Maddalena, Italy, in the United States Navy, Jennifer was taking up the helm here in Tippecanoe County and planting the seeds for the growth that she just talked about. So 2004, North Central Health Services granted funding to MHA for the construction of this Mental Health Association community building. In 2005, the Mental Health Association community building opened to the public. And at the time of the ribbon cutting, then the Joey A. Seaman Memorial Mental Health Library opened to the community on the main floor. And that's where Steph is standing right there. This was also refurbished in 2023 due to some generous donations in memory of Joey. To keep that alive, very much a part of our institutional pillars. In 2006, the Mental Health Association changed its name to Mental Health America, and the Tippecanoe County affiliate organization became known as Mental Health America of Tippecanoe County. And in 2013, I don't know what you were doing those 7 years, but evidence-based mental health education began to be provided by Mental Health America, became certified to provide QPR, which we still use today. It's evidence-based suicide prevention 101, extremely helpful in de-escalating suicidal ideation and getting help. And then moving to mental health first aid and youth mental health first aid courses. In 2014, MHA of Tippecanoe County and the Lafayette Crisis Center Foundation legally merged on September 2nd of 2014 with MHA as the lead agency. And all of those programs, except for the 211 services, were then provided by MHA. And those included the 24/7 crisis lines, the community services directory, the rape survivors advocacy series, which I believe the YWCA is now handling, the survivors of suicide support group, which still meets here monthly, and women who've been their support group, which I believe the YWCA, who is now the certified rape crisis center in this county, provides. In 2016, is that? Yes. In 2016, the first mental health care forum was moderated by the new United Way of Greater Lafayette CEO, Michael Budd. And that community conversation identified long wait times and in some cases, no wait lists for people who are seeking mental health care. And in 2017, to assist people caught in the months-long gap between scheduling with the provider and their first appointment, NCHS, the Community Foundation of Greater Lafayette, and the United Way of Greater Lafayette partnered with MHA to fund a pilot Systems of Care Navigator program. And our Navigator program continues today. Navigators connect people with the local providers and basic needs services they require. The System of Care Navigator program now functions as one of our most accessed permanent services and I looked at the numbers last week. We have served over 6,250 individuals and families in connecting with appropriate clinical care through that program. So we thank the foresight. And in that year that I took over in October of 2019, I inherited a small application pilot program to the United Way to help further fill that gap, because wait lists were still a reality. So those clients served by the Navigator program, and we launched a Let's Talk peer program, which was funded just prior to COVID in 2019. And it has been a great success. We moved it to peer recovery coaches in 2020 to maintain an evidence-based perspective and really be aligned with the future of mental health care. But the program itself was based on the friendship benches model from Zimbabwe. And the foresight of Jennifer Flora to understand that Let's Talk was a program that would benefit our community, even for people that weren't necessarily ready to begin their journey into clinical care. It provided an empathetic ear and an opportunity for people to connect with someone who's been there, someone with lived experience and a state certification that would help them set small goals that were achievable and also provided accountability. This is our fastest growing supportive service that we offer. Just running the numbers last month, we served 388 appointments in the Let's Talk program in the month of January, compared with 95 the month in 2024 of the same month, and compared with 7 the year before that. Very quickly growing. And we're going to have some folks talk a little bit more about what that program is and what it means to be a peer. In 2022, following the rapid change brought on the COVID-19, I think we skipped some stuff here because I'll tell you what, the 988 journey began with a major grant that Jennifer Flora herself wrote. That was a capacity building grant, and I believe that was 2018, circa 2019. And that path led to 2021, the FCC really implementing that 988 3-digit number, and we went live in January of 2021. But I want to remind folks that during that time, we experienced a global pandemic. We were largely a volunteer organization, almost completely, with the exception of a couple of part-time folks. And in 2022, after we merged with the MHA of North Central Indiana, growing to cover the Cass, Clinton, Howard, and Miami and Tipton counties, we also became officially one of the 4 centers that are providing 988 call services to the state of Indiana. And that has been a huge capacity building for this organization. We essentially quadrupled our workforce, and it's been a journey. And in 2023, we renovated that day shelter that we were talking about that's behind us. And it is a new crisis center. It was officially open in August on the same lot with the Potter House right next door. And it has space to support the increased staffing of our 988 line. Although I will tell you, we are kind of busting at the seams again. So growth is beautiful, and it has its own challenges. But previously, as I said, previously a volunteer run, now we boast, I think, over 30 dedicated employees to that line. And in 2020, and just since we were talking about numbers, to be fair, got to be fair to the crisis line. In 2019, we served just under 4,000 calls from the National Suicide Prevention Lifeline, which is now the 988 line. And last year, our numbers were over 30,000. So these folks are working as well. Was it last Friday? These weeks are running together. Was it the Friday before we launched our next program, looking to the future. MST, multisystemic therapies. We launched that on February 7th. And we are also just looking to the future, launching on March 1st, our mobile crisis team in Carroll County. And we're going to talk a little bit more about the vision for the future. But thank you for walking down memory lane with me. I probably took way more time than I was supposed to, but I will now go ahead and introduce you to some of the folks who are on the ground working.
I'm a 25-year-old, I guess, postgraduate student at Purdue, and graduated with a computer science degree from Purdue. And I had some time on my hands. And a crisis center volunteer in 1978 said to me, "Why don't you think about becoming a crisis center volunteer?" I thought, why? Well, I think you'd be good at it. Okay, well, so I looked into it, and sure enough, it was something that really made a world of difference to me. And now I'm in my 70s, and the Crisis Center has been a really integral part of who I am and what I'm about. I remember back in '78 when I first moved into the building over at 8th and Union. It's a small little building. And we had a sofa. On each end of the sofa was a phone, and then 2 recliners. And there's a phone next to each one of those. And when a call would come in, there would be at least 2 people on a shift, and one person would be talking, and the other volunteer would be like writing notes as they would listen in and make suggestions. And that's how you learned how to become an effective crisis center volunteer. Now, we still had a training. It was like very intensive, 4 weeks, 2 meetings a week. And you learned the skills about topics were relationships, sexuality, drugs, because the crisis center actually started in '70 because Don Hartsaw and some graduate students saw a need for the drug culture to have a place to call because they didn't trust the establishment. Remember, that was back in the '60s with the drugs, were LSD and marijuana and whatever. So needless to say, most of the volunteers were very knowledgeable about drugs. They were the hippie types. And I remember hearing stories of the parties that they would hold. And I really wasn't into that. I was pretty much a very conservative guy back then, but boy, some of the stories that I've heard. So that was how it was back in the '70s. Now, throughout the years, there's been changes. We're in our 4th, at least I'm in the 4th different building. Next door, as Brandy was talking about, and then talk about a difference in technology. I mean, we would have logbooks where we would write in like a synopsis of what the call was that we had, and any referrals that we gave were in this big black binder that we had created. And now each station has like a computer and another wide screen, and we can go into online to find the resources based anywhere in the country somebody might call us from. So we can even the phone system is digital. So you can really take calls from home if you needed to, which is what we did during the pandemic. Excuse me. So, but now we're back in the building, and it's just a difference between night and day about the technology that we had back then versus what we have today. Now, what's not different is the reason I choose to stick around, and that is the people. The people, when I became a part of the Crisis Center, very supportive, kind, compassionate. I wanted to surround myself with that kind of people, and I did. And in the '80s and '90s, there were 3 other people besides myself who were volunteers. And we decided, we just like being around each other, so we created a men's support group. And we met every other week at one of the guys' houses for 20 years. And it's just like, that's the kind of relationships that we built because of the people who were a part of the Crisis Center. Now, back then, you could only do one shift a week, and it was 4 hours because they didn't want people to burn out. And most of our volunteers were Purdue students too. So we didn't want to, take them away from their schoolwork. Well, today, we have like most staff that answer the phones are paid staff, whereas back then it was all volunteers. And I was kind of worried that the quality of service would go down, the compassion would go down because people were being paid to do what we did for free. And boy, was I wrong. I had a chance last November to interview all of the crisis specialists and found out that everybody there is there for the right reasons. They care. The reason I stay around, like I said, is the people, not just the people surrounding me, but the people I talk to, because you make a connection, and that's what people want and what they need. And when I needed somebody back when I was younger, there were people there to support me. And so I wanted to pay it forward, and that Crisis Center gives me a chance to do that. At the same time, I get so much more back than what I put out. So I guess, to say it's been a staple my whole life is true, because, it's been 46 years that I've been a part of this organization, and I'm so proud of the leadership that we have. It's more mainstream now than it used to be, and I think that's a good thing. And we've had some growing pains, but because of the leadership that we have, it's just going in the right direction. I can just see that, and I've had a lot of experience to base that conclusion on. So, just want to say I'm grateful to be a part of this place, and as long as I'm able, I'll probably still be around. Thank you.
I've always said, as long as Kevin Kors is still here, I'm doing okay. He's gold. 46 years, I think. 46 years. Wow. It's really hard to move on from that, because I get so touched with that, because I know that our crisis specialists that are younger are in good hands just for him being there. So I'm so grateful. But I do have to move on, unfortunately, to another program. I need to introduce our clinical director, Stefka Pauliet. And before I bring her up here, I want to kind of paint the picture of how she came to be a part of our team. When we had the Let's Talk program and we were talking working with peer recovery specialists, this is a different group of people to manage. Okay. Peers are not like any other folks that you have ever worked with. They come with a completely different skill set, completely different, challenges, and just a completely different understanding of what their role is in an organization. And I didn't really have a lot of experience working with that group. And I had some scares because for me, recovery is so important. It's something to be protected. And so when you're asking people to come and work for you that are in recovery, it seems like a really important thing to make sure that you are giving them the best care to maintain their own recovery, making sure that they're not getting in the weeds outside of the scope of what they're trained to do, and also just making sure that there's a culture that can withstand the unique properties that peers bring to the program. And so I actually had reached out to Stefka as a contract employee to help us really provide some supervision, some clinical supervision to the peers, because I knew I was not equipped to do it. And after a year, we saw really good retention rates. We saw that the culture was a culture of providing those supports, empowerment, all of our values. And I asked her to come aboard to be a full-time member of the team, not only to continue to provide that supervision that was so needed for the peers and the navigators, but also because of the innovative strategies that we were beginning to look at implementing to address some of the more upstream programs such as MST that we were looking to get involved in. So I knew we would need an LCSW. She was already proving to be a great fit. And so she's been with us on paid staff over a year, and with contract would make it about 2 years. And so so it's my pleasure to introduce Stefka, our clinical director. And Stefka, if you please come on.
Thank you. Hearing how we got to be where we are today helps me really understand why I'm able to do what I do. If it wasn't for the people who thought we have a great community, but what can we do to support them, had the courage to have a vision and try things when other people weren't. If it wasn't for all of that, I wouldn't be allowed to do all the things that Brandy has allowed me to do. I often feel like I can tell Brandy, I have a wild and crazy and terrible idea, but you're really going to like it. And she takes a deep breath and she'll let me go with it. So one of those wild and crazy and terrible ideas was something called multi-systemic therapy. It's structured family therapy that's focused for youth that are at risk. So youth that are at risk from being removed from their homes for behaviors, whether it's fighting at school, not going to school, fighting at home, just behaviors that if those were allowed to continue, they would end up being removed and maybe put in juvenile detention or placed away from their families. And we know that although families are unique and beautiful and different and unique, sometimes they need a little help to be able to keep everybody going together. So that is what multi-systemic therapy is. We opened it on February 7th, and I see my 2 MST team members are out in the community. We received a referral last night from DCS from Howard County, and right now they're out there meeting with the family to see how we can get them connected into our system. So that's really exciting. Ideally, what it does is it takes 3 to 5 months where therapists go to families in their home and they work around family schedules. So families don't have to take time off from work or other things that they need to sustain themselves, because we work around them and we work with them, with the ultimate goal of everybody in the family working with all the systems that come in connection with them to achieve wellness. Results are really good. In Indiana, it's been around for over a year, and they have a 90% rate of families who have been in treatment not returning back to needing services again, which is really fantastic. If you know anything about DCS related families, to have that type of success rate is unheard of. So really excited that have the opportunity to do that and then bring that back to MHA. The other thing that's really excited is we're going to start our MCT in Carroll County on March 1st. So MCTs come in all shapes and sizes. What's really interesting about the MCT in Carroll County is we are tailoring it specifically to their needs. So law enforcement tells us these are the items that we need addressed. We say, okay, great, we'll take those and we'll address them. So where does all of this come into play? So all of these systems are so interconnected with the foundation of supportive services. Supportive services is what takes anybody in our community and any of the communities throughout the state and gets them their basic needs. Let's say that somebody is struggling with housing. We know people who can get people into housing. We know people who can help pay for rent. We can find sustainable housing for people. If they're struggling with food, we have relationships with people in the different counties that provide food services. We have relationships with therapy providers. It's not unusual when a therapy organization hires a new therapist, they call us because they know that we're going to fill them up right away. So we have the ability to navigate really long wait lists because of our relationships with providers. And the same with primary care. Through this, families need somebody to talk to and help with them get through these challenges. If you're working on tackling 5 big things such as food, housing, finances, primary care, and therapy, that's a lot for somebody to navigate. So our peers work with them and help them navigate those frustrations and challenges. So it's because we have this wonderful supportive services program that we're able to bring in these other programs, and they're all interconnected. And then it helps us to collaborate with the community and then the members of our community. So every community we're in gets to stay healthy and continue to improve.
We talked about two of the three pillars of, well, actually three of the three pillars that Mental Health America rests on: education for prevention, intervention, which is our supportive services, and crisis stabilization through our 988 Center. Having said that, we are definitely looking to the future. We're excited. We, as I mentioned earlier, have engaged with our thought partner and implementation driver, the Bradford Consulting Group. From that was born this new iteration of our mission statement, which really focuses on how we are not doing this by ourselves. We do this together with our communities through communication, connection, and collaboration to achieve better mental health for all in the Wabash Valley region of North Central Indiana. Some things to look forward to. First of all, we're super excited. We do have some representation from IU Health to talk about our bus project that we're rolling out in 2025, meeting youth where they're at with mental health solution, advocacy, and stigma breaking. We're in phase 1 of that project, so thank you to IU Health for that. Thanks to Arconic Foundation, because we were able to bring in a storefront to junior achievement, trying to get into youth-facing organizations. Met with the mayor of Kokomo, saw him out there yesterday, talking about our youth advisory councils. So really getting in with youth to meet them where they're at, figure out what they need, and help empower them and support them to drive through their own solutions. We're also still putting a huge emphasis on that suicide prevention training. We wanted to thank Duke Energy for giving us a veteran-specific suicide prevention grant this year, and we also have a partnership with Franciscan Health on suicide prevention training. We also have a great relationship with Riverbend Hospital, who is actually sponsoring this event. They're our key sponsors and also our partners in a lot of our other services that we're delivering in the community. So thank you for coming. We, as Stephen alluded to earlier, how we celebrate here at Mental Health America is we ring that bell when we have a huge success. We brought that bell in to ring during COVID when we were experiencing high acuity, high caseloads, morale was low. I went and stole the bell from Howard County and put it up there, a smaller version. I'm not even take it back. You're all right. So anytime one of our clients got an appointment, or anytime someone celebrated a milestone in recovery, or one time we had a young lady that got her kids back because of the work that she did for 1.5 years with a peer. Sometimes I get to ring the bell because I'll land a grant or have a really great opportunity. So today I would like to ask, and I'm sorry I didn't give you the courtesy of asking you in advance, but I would like to ask Jennifer Flora to ring the bell, the bell that resides in our lobby that was also smelted in the same foundry as the original Mental Health America Hope Bell. If you could ring the bell to kind of conclude our first Founders Day breakfast, which will then initiate a tour for anyone who's interested in taking a tour of the facility. I think Josh is, and some of our other staff are going to be on hand to just show you where the magic happens. So again, thank you so much for your time and attention. Thank you for NCHS for sponsoring. Thank you for Jane's Gourmet for providing that nice breakfast. But most importantly, thank you to all of you, and especially those of you that have been with us for so long on our journey. It's very exciting. The future's bright, but we know we stand on the shoulders of those that were here before us. So thank you for taking a moment to acknowledge that with us. Jennifer, if you... Thank you.